Have you noticed your cat sleeping more than usual, refusing the tuna they once adored, or hiding downstairs for hours? Maybe they used to greet you at the door, and now they glance once and walk away. It's easy to say, cats are just like that. But sometimes those small shifts are a soft alarm. Your cat might be quietly struggling. Cats hide sadness the way they hide pain. Silently, politely. So we often miss it until things feel heavy. Today, I'll walk you through 10 quiet signs your cat may be depressed, why each change matters, and the exact, gentle steps you can take to help. This is careful, practical, and hopeful guidance you can start using tonight. But before we jump into that, let me say one thing. This isn't about views, numbers, or algorithms. This is about your connection with your cat. If you want a deeper bond, if you want your cat to feel safe, seen, and understood, then hit like, subscribe, and stay with us. Because the more people understand how cats really communicate, the better life becomes for thousands of cats out there, including yours. Let's begin with the most common, easy-to-miss sign: loss of appetite or changes in eating. Food is a clear window into a cat's world. If your cat slowly eats less, turns away from a favorite treat, or alternately overeats, something has shifted. A drop in appetite can signal pain, dental trouble, or a blocked throat. But it can also be an emotional dulling. When the joy linked to food fades, it's a red flag. What to do? Start with a vet check to rule out medical causes. If the vet gives the all clear, make meals more inviting. Warm, wet food to strengthen aroma, small, frequent portions, or hand feeding during calm moments. Try puzzle feeders to make eating a game. The goal is to reconnect food with pleasant, predictable moments. Sleeping more and low activity. Cats nap a lot, but depressed cats nap differently. Longer stretches, less curiosity, fewer bursts of playful energy. They may lie in unusual spots or simply follow you with their eyes, but not their feet. What to do? Reintroduce movement slowly. Short, gentle play sessions, 2 minutes 2 or 3 times a day, can spark interest. Use a feather wand or a quiet rolling toy that mimics prey. Keep play at consistent times so activity becomes a safe, expected part of their day. Celebrate tiny wins, a paw reach, a tail flick, a half-hearted pounce. Those micro moments are progress. Hiding and withdrawal. A cat that suddenly spends hours under a bed, behind a couch, or in a closet may be protecting itself emotionally. Withdrawal can look like solitude, but can hide fear, sadness, or overstimulation. What to do? Respect their hiding place, but make it inviting. Put a soft blanket, a familiar scented piece of clothing, and a low-noise toy nearby. Sit quietly in the room doing something calm. Read, work on your laptop, so your presence is safe and non-demanding. Avoid forcing contact. Instead, leave a trail of tiny treats leading out to a warm sunspot to encourage small explorations. Changes in grooming. Too much or too little? Grooming is a cat's comfort ritual. A depressed cat might stop grooming and look unkempt, or they might overgroom until fur thins or the skin reddens. Both are coping signals. What to do? First, rule out skin issues with the vet. Then offer gentle grooming sessions. Short brushing that feels like a massage. Soft, rhythmic strokes calm many cats. For overgrooming, provide enrichment and stress reduction, puzzle feeders, safe high perches, and pheromone diffusers as recommended by your vet. If behavior persists, ask about behavior therapy or medical options, litter box changes or accidents. Going outside the box is often medical. Urinary tract issues or pain can make the box scary, but emotional distress also causes avoidance. A cat may stop using the litter box because it feels unsafe or unpredictable. What to do? Rule out medical causes first. Ensure you have enough boxes, 1 per cat plus 1, using large open boxes with unscented litter in quiet, accessible spots. Scoop daily. If the cat associates the box with stress, Create a calm route to the box and pair visits with tiny treats or a short positive ritual. Loss of interest in play or interaction. Play is joy and practice. If your cat stops chasing string, ignores window bird watching, or avoids your outstretched hand, their inner curiosity has dimmed. What to do? Try micro-motivation. Offer very low-effort toys. A single feather flicked slowly, a small plush dragged across the floor, or a short puzzle feeder. Keep sessions brief and predictable. Praise softly when they show any engagement. Rebuild the loop of curiosity. Arrow action, arrow reward. Over days and weeks, small playful sparks can become brighter. Changes in vocalization. More or less. Some depressed cats lose their voice. Others call more, softly or insistently. Sudden new vocal behavior can be a plea or a symptom. What to do? Track when and where vocalizing happens. Is it at night? During separation? After certain events? Offer daytime enrichment to reduce boredom. If the vocalizing seems tied to pain or distress, seek veterinary advice. Respond with calm tones. Answering frantic meows with frantic attention reinforces anxiety. Instead, use slow, soothing reassurance. Shifts in social behavior with other pets. A depressed cat may withdraw from housemates, avoid grooming sessions, or become irritable with other pets they once accepted. What to do? Provide separate safe zones with food, water, litter, and beds for the withdrawn cat. Reintroduce social contact slowly. Feed the pets near each other at a respectful distance. Gradually bring them closer over days while watching body language for signs of calm. Use positive pairing, treats, quiet praise, to rebuild safe associations, repetitive or compulsive behaviors. Pacing the same path, circling, tail chasing, or constant rubbing in one spot are signs of stress becoming routine. These repetition loops are a coping method that can become harmful. What to do? Break the pattern with enrichment. Offer puzzle feeders, rotating toys, scent trails, or supervised window watching sessions. Introduce short, frequent play to interrupt loops. If behaviors persist, consult your vet about behavioral therapy or medication. Subtle changes in eyes, posture, and movement. Depression changes micro-expressions. Duller eyes, slower movements, flattened posture, and a lack of the feline spark. These are small but meaningful shifts in how your cat carries themselves. What to do? Mirror calm in your body language. Slow movements, soft voice, and gentle eye contact. Slow blinks. Encourage short, safe exposures to sunlight and a comfortable perch by the window. Journaling small behavior changes. Appetite, sleep, play, litter use helps you spot trends and share useful notes with your vet. I want to hear from you. Which of these quiet signs did you spot first in your cat? Share your experiences in the comments. Tell us what changed and what helped. Your story could help another cat parent notice a sign they otherwise would have missed. And if this guide matters to you, please like and subscribe so we can reach more people who want to care for cats with knowledge and kindness. A gentle, step-by-step recovery plan. If you see multiple signs, take action gently and steadily. Here's a clear plan you can follow. Start with the vet. A full checkup, blood work, and urine test rule out physical causes. Many emotional changes begin with pain or illness. Create safety through routine. Predictable feeding times, short play windows, and calm evenings give cats an emotional map. Routine reduces anxiety. Small, daily enrichment. Window perches, food puzzles, and rotating toys help ignite curiosity. 2 short play sessions a day are better than 1 long, exhausting session. Respect control and space. Let the cat come to you. Offer treats nearby rather than picking them up. Provide high perches and hiding spots so they can observe safely. Comfort with scent and texture. Soft blankets, a well-placed box, and items that smell like you help them feel anchored. Consider pheromone diffusers if your vet recommends them. Slow social reintegration. If other pets are involved, feed at a distance and reduce forced interactions. Use positive associations to slowly rebuild calm relationships. Track progress. Keep a simple log: appetite, sleep, play, litter use, and social interactions. Celebrate small steps forward: a sniff, a blink, a paw tap. These are real wins. Ask for help early. If environmental changes don't help, consult a behaviorist or your vet about medicine or tailored behavior plans. What to avoid. Don't punish withdrawn behavior. That makes things worse. Don't force interactions or isolate them entirely. Both extremes harm recovery. Don't wait weeks to act. Early small steps prevent long-term harm. Don't assume age explains everything. Older cats need checks just as much as younger ones. When to seek urgent help, contact a vet immediately if your cat stops eating for 24 to 48 hours, shows severe lethargy, has repeated vomiting or diarrhea, breathes rapidly, or becomes unresponsive. Cats can deteriorate quickly when they stop eating. Professional help is vital. Cats speak softly. Depression is not a failure of love. It's a quiet signal that their inner world has shifted. With patience, kindness, and the right steps, most cats rebound. Your steady presence, predictable meals, tiny play rituals, respectful space, and calm routines is the most powerful medicine you have. If this video helped you notice a sign you hadn't seen before, please like, share, and subscribe. Tell us in the comments the first quiet change you noticed in your cat and what helped them begin to feel better. Your experience might save another cat from a long, silent struggle. Now, go find your cat. Sit quietly at their level, soften your eyes, and offer a slow blink. Leave a small treat nearby and keep your voice calm. These tiny, patient moments add up, and they can be the start of a brighter, softer path back to curiosity and joy.